Megan asked, I'm experiencing pain in my wrist when I do straight or easy bar curls. I tried to change my grip, but no use. It's a sharp pain that occurs during flexion or contraction of the bicep. It dulls shortly after and then goes away. What should I do? I wanted to deviate a little bit. I know we do a lot of Q&A on nutrition and health in general, but obviously fitness is a big part of health. My first degree was in physical therapy. I'm a licensed orthopedic physical therapist, and this is one of my favorite topics. As a kid who was growing into athletics, that was my first love, training and just being fit, just the lore of the gym, you know, building muscle, feeling great, and all that goes along with athletics. So this is something I still love to do, and I think if anytime somebody's active, you're going to have to work with injuries like this. And if you don't have that kind of a background, it's sometimes very difficult to know what is kind of an emergency that I need to get some attention for, medical attention, or what's just maybe a strain or cumulative trauma issue. So I want to go through some things to look for. Obviously, I cannot diagnose an injury through the internet or without seeing anybody, but there are still some things that you can go through to just discern whether it's something to be worried about or not. So the first thing I want to note is that Megan gave a great description. She said, it hurts when I contract the muscle and it hurts here. Those are two important things. When does it hurt and where specifically? I'll often ask a client, email me a picture and point to exactly where it hurts, because anatomy is anatomy. I had another client earlier this month who had some pain at her lateral knee, and when she pointed to right where it was easy to see that that was the IT band tendon. Could have been the bicep femoris tendon on the other side. It could have been even the gastroc tendon way up underneath. Could have been more on the suprapatellar tendon. Just depending on the location, could even be the joint line. But with a specific location, you can really identify what might be the cause. Secondly, think of how it happened. Were you squatting when you felt some pain, or was it when you were throwing a football? You know, that mechanism of injury is going to be critical as well. So think of those things, and then you might also be able to decide, is this a contractile tissue, or is it more of an inert type thing, like cartilage or ligament or bone? So in her case, just to go back to that example, she said it hurts from her wrist all the way up to her elbow when she flexes. So the wrist flexors, the muscles that come down the medial side of the arm, you know, the median nerve comes through this area as well, and it hurts when she contracts. So my first thought, of course, is a muscle strain. And what I would say is, of course, always consider icing the area. Ice massage particularly helps. You can look that up, what that entails. Stretching. So if I'm going to stretch the wrist flexors, it's going to be with the elbow extended, and then also extending the wrist. So now I'm putting that area in maximum stretch, but very lightly, of course, if it's an acute injury. And the main thing is just to avoid what hurts for a while. It's going to sound very cliche, but if something hurts, don't do it. You know, that particular muscle group, she might feel great in a certain grip. If she pronates a little bit, it's going to put more of the force through the lateral side, or the extensors brachioradialis, brachialis, and she might feel fine. But still, because she has to grip the weight, you know, it might hurt a little bit, so she might have to lessen the weight. I'm all for working through or around an injury as long as you're not making it worse. So consider just lightening the weight, lessening the weights, as well as changing things as far as the exercise. And unfortunately, you might just have to take a week or two off. I often say it's way better to take a little time off than having a long-term injury, because if a tendinitis or tendinosis runs its full course, and a strain, an acute strain, can become tendinitis, they can take up to 18 months. And I've had those kind of injuries everywhere you can possibly have them, every joint from sports and lifting and so forth. And it can go away in 3 to 6 weeks, all the way up to 12 to 18 months. So take care of it, rest, stretch, ice. If you need to get diagnostics, certainly see a physical therapist or a medical doctor, and I think you'll always find some good information there. But take them that kind of information, how you hurt it, when it hurts, and you know, try and consider the different types of injuries you can have, a sprain or a strain or even cumulative trauma. a sprain, a lot of times people will say, you know, they've sprained something, and that's a joint. You can only sprain a joint, and that's from hypermobility, actually moving the joint beyond where it should move. For example, I dislocated my ankle a couple years ago, complete lateral dislocation, and it was so far over that it tore ligaments on both sides of the joint. Ironically, it moved the foot so far over, it even tore part of the muscles on my lateral leg, the peroneals. You could see tear lines right there, bruising through strips of the muscle. So that's a traumatic injury where most of us are going to feel something in the gym or athletically just because of the activity that we ensue or pursue. So the thing that you're gonna want to consider when you are contracting something and feel pain, that's probably muscle, but you also have things like disc injuries or nerve injuries, and that's something that can kind of cloud the issue a little bit. So I would say those are the things when you're having specific back or neck pain, you probably want to have somebody take a look at it. But the normal run-of-the-mill injuries in the gym, those are the things I would look for.